Good morning, everyone. Thanks for coming together. My name is Helena Chu, and I'm the chair of the department. It's been a pleasure and it's an honor. I've been chair for 17 years, and I've seen the department grow, from like 12 residents to 18 residents, and from maybe 6 fellows to 12 fellows. You're all here for different subspecialties. We have about 10 subspecialties in critical care, neurology and stroke, epilepsy, headache and general neurology, Parkinson's and movement disorders, ALS, neuromuscular disorders, Alzheimer's disease and memory disorders, multiple sclerosis and neuroimmunology, rehab in both inpatient and outpatient. Our history goes back over 100 years. We started out as a training program at the General Hospital. It's kind of famous on TV, LA County. We've been like a family between neurology and neurosurgery. And I think that's been the key, because kind of with pride, we are number 19 by US News and World Report for neuroscience. So you can hold your head up high when you say you trained at USC. It's kind of hard for me to believe, number 19. During the past 10 years, the university has made major investments in neuroscience. Our NIH funding ranking moved from number 30 to number 4. So we have, just looking out the window, the ZILCA, Neurogenetics Research Institute, and right there, the Broad Stem Cell Regenerative Medicine Institute. We have the Stevens Neuroimaging and Informatics Institute, a beautiful space with lights. It looks like a spaceship. There's over 15 faculty members there, and they're part of the Department of Neurology. If you're interested in research, we have a lot of opportunities here. And we've come a long way in the 17 years I've been here. Our goal is still to train the best experienced, skilled, compassionate clinicians. Welcome to our academic community and home, and to our family. Your program director's doors and my doors always open to you.
Hi, my name is Victoria Cannon, and I am here to talk about the USC Clinical Neurophysiology Fellowship Program. I really wanted to do a clinical neurophysiology fellowship program that had equal parts training in both EEG and EMG. Many programs just focus on one, and then you get peripheral training in the other. But what really drew me to the USC Clinical Neurophysiology Fellowship Program was that you get essentially half and half of each. So for that reason, I applied and interviewed and had a very positive experience interviewing, and really enjoyed meeting the faculty, and knew that I would get exquisite training here and gain the knowledge that I needed to. And so for that reason, I chose to come here, and I was accepted, and I've had a very good experience. I considered my neuromuscular and my epilepsy knowledge base to be very much lacking before I started this fellowship program. And even within a few months of being in fellowship, I began to consider those to be my strengths. I took the neurology board exam a couple months into fellowship, and I was really worried that my neuromuscular and epilepsy knowledge base would be a problem in taking my board. But even within a few months, I felt very confident in going in and taking that board, and did very well and passed. So even at the beginning of fellowship, I was already getting really good training. In this fellowship program, it's pretty much a 50-50 exposure to both the epilepsy and neuromuscular subspecialties. So you do 2-month blocks, and you do 2 months of EEG or epilepsy, 2 months of EMG or neuromuscular, and then they have 2 months of a combined rotation where you get kind of half and half. So at the completion of a year, you've really gotten essentially half neuromuscular and half epilepsy. There's a very wide range of exposure as far as the patient population is concerned, and there is a very hands-on approach by the attending physicians, but not too much to the extent where you are not allowed to gain your own independence in, performing and interpreting these diagnostic tests. So it's really kind of the perfect balance. All of the attendings are extremely invested in the education of the fellows. And they've got a wonderful didactic schedule, and also they'll have additional kind of one-on-one sessions with attendings and the fellows that were incredibly helpful. So lots of experience and lots of education. So it's a really nice balance. We spent a good bit of time at LA County Hospital and the clinics within the LA County medical system. And then we spent a good bit of time here at Keck. So from a neuromuscular standpoint, we have multiple clinics per week in which we are involved here at Keck. So there's the Keck Neuromuscular Clinic, and we see a very wide array of pathology there. We also have a monthly neuromuscular clinic at LA County, and the patient population is different. It's an underserved population, and so it's a little bit of a unique experience for that reason. But we also get a very wide array of pathology there. So the combination of those two clinics is a very comprehensive clinical exposure. And then we do electrodiagnostic testing, so EMGs and nerve conduction studies at both locations. And so we get a very wide range of experience in doing that as well. We have the epilepsy monitoring unit here at Keck, which is an inpatient service that is specifically for patients with epilepsy who are coming in to have essentially a workup for potential epilepsy surgery. And so we get a good bit of exposure to different kinds of epilepsy patients in that respect. But we also have an epilepsy clinic at LA County that's a weekly clinic, and we get a lot of exposure to different epilepsies and patients in that respect as well. So we sort of get a kind of intense inpatient exposure as well as an intense outpatient exposure. We are also responsible for reading EEGs at LA County, so any EEG that comes in during the day and also any EEG that occurs overnight, the fellows are responsible for reading. And it's a pretty substantial amount, and so you get a good bit of exposure and experience in interpreting EEGs. That's another really nice thing about this program. There's a really good pediatric exposure both to the pediatric epilepsy subspecialty as well as a pediatric neuromuscular subspecialty. So during your combined rotation, you spend 2 days of the week at Children's Hospital in Los Angeles, and you both get to perform EMGs and nerve conduction studies on children and interpret EEGs from children with epilepsy. There is also a multidisciplinary clinic that's every Friday that we participate in, and so you also get a lot of good clinical exposure. So you both get exposure to these electrodiagnostic tests in the pediatric population as well as the pediatric patients themselves. So IUM is intraoperative monitoring, intraoperative neurophysiologic monitoring, and you do get training in that as well in this fellowship program. So during your combined rotations, you'll spend a day and a half a week in the IOM lab looking at cases with the IOM fellow and the IOM attendings. And then during your epilepsy rotation, you will get lectures regarding interpretation of polysomnography or sleep studies. That's a really nice thing about the neuromuscular program here. They have a wonderful ALS multidisciplinary clinic that is extremely well run, very well organized, and they have actually won the ALS Center of Excellence Award this past year because they do such a wonderful job at conducting that clinic. And it's an incredibly fulfilling clinic to be a part of. And I think that is probably one of my favorite components of this fellowship, was getting the opportunity to be involved in patient care in that regard. You know, ALS is a devastating disease to be diagnosed with, and it can be very tough to, as a physician alone, take care of all of the needs that a patient who's been diagnosed with a motor neuron disease would require. And in this clinic, you have literally every discipline that they could possibly need. So speech therapy, physical therapy, occupational therapy, a social worker. We even have people within palliative care involved recently. There's a wealth of didactics in this program for sure, and that was something that I really enjoyed. There's a weekly didactic session that basically balances between neuromuscular didactic sessions and the epilepsy-related didactic sessions. We also had some one-on-one small group sessions pretty frequently with the attendings, which was really nice to get that good time with them. And when you're on your combined rotation and you're rotating through Children's Hospital, they give an epilepsy lecture twice a week, and it's incredibly helpful as far as learning about pediatric epilepsy, which can be quite different from adult epilepsy. So lots of learning. My goal coming into this fellowship was to complete it and to feel competent and confident in performing my own electrodiagnostic tests and interpreting those electrodiagnostic tests. And I can very confidently say that I accomplished that goal. When I actually first applied to this fellowship, I just finished my second year of neurology residency. I wasn't really sure what exactly I wanted to do as far as my career was concerned, but I really enjoyed all of neurology at that point, and I wanted to be a general neurologist. And I felt that it was my duty to, as a general neurologist, be competent in performing and interpreting my own EMGs, nerve conduction studies, and EEGs. And so I feel pretty strongly that if a neurologist is planning on doing those things, that they really should pursue additional training in that after residency, because most residencies are not going to give you the training that you need to be able to do those things competently. And I feel like you owe it to your patients to provide the best care that you possibly can in that regard. You get the training that you need to be able to do that 100%. I knew absolutely no one when I moved out here, and everyone was very welcoming, and everyone was kind of aware that I had moved across the country and didn't know anyone, and everyone was very kind. And I had attendings invite me to come over for Thanksgiving because I don't have any family here. It was just very much a family sort of environment, and that meant a lot to me. I didn't expect that. And I'm very thankful that it was that sort of environment. I think it really made fellowship a much more enjoyable experience.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.